Hi, I'm Jessica,
And I'm Jacqueline.
and we're part of the surgical team here at Chippewa Animal Clinic.
This is Rome. He's actually one of Dr. Hall's ACL repair as well as the luxating patella repair patients.
Today we're going to go over the proper care and rehabilitation for any type of surgical knee repair for your furry friend.
You will receive written instructions when your pet leaves the clinic, and you should begin using the instructions immediately after bringing your pet home. First and foremost, do not remove your pet's e-collar until the sutures or staples are removed here in the clinic. Early removal of this e-collar can lead to damage or infected incisions, which can further lead to catastrophic complications and failure of surgery.
Let's talk about the bandage that your pet will be wearing after being discharged from the hospital. We're going to want you to keep this on for 72 hours, and that's roughly 3 days. After those 3 days, you can remove this bandage at home. And don't worry, if it comes off or gets loose, you can go ahead and remove it. We just want you to try to keep it on for at least 3 days. After removing the bandage, if you notice any swelling, redness, or discharge coming from the incision site, please let us know. We'll want to check it out. In the meantime, you can start applying the triple antibiotic cream that you can get over the counter. It's just kind of like Neosporin. You're going to want to put that on at least twice daily.
So the next thing we're going to talk about is massage. You're going to want to do a 2 to 3 minute massage before and after every exercise. So in order to do the massage, you're gently going to rub the muscles at the front and at the back of the thigh. You're going to start by applying light pressure, and then you're going to gradually increase the pressure over the course of the 2 to 3 minutes. Again, be sure to do this before and after every passive range of motion exercise.
Now we're going to move into discussing the passive range of motion exercises. All right, so to begin the passive range of motion exercises, we're going to gently place our hand under the knee and supporting it, and also placing our hand under the hock of the limb. And we're going to want to do these repetitions about 10 times, 2 to 3 times daily. And don't forget to ice before and after each time. So what we're going to start to do is gently flex the bottom part of the foot up and then extend out. Up and out. Up and out. And we want to take note not to twist the knee or the leg in any way. And if your pet is feeling any kind of discomfort or crying out in pain, just stop immediately. And then we would take a break and then start again. And then so now we're going to run into going into the running motion of the limb. So to do this, we're going to gently, again, flex up and out. Up and out. Up and out. So you're creating a running motion. And again, if there's any sign of pain, just stop.
Okay, next we're going to talk about icing. Again, it's important to remember that we ice before and after each passing range of motion exercise. Additionally, we're going to just want to make sure that we're icing at least 3 to 4 times a day. Be sure to wrap your compress in a towel. We don't want the ice pack itself touching the incision. A number of reasons. One, it's going to get too cold. 2, we want to make sure to keep that incision site dry. Let's see here. This is just a commercially packaged gel ice pack. You could just use a bag of ice. You can use frozen peas, just as long as you're wrapping it in that towel first. We want to make sure and do this for as long as the pet will allow, but we do not want to exceed 10 minutes. So again, 3 to 4 times a day for up to 10 minutes each time. More is fine. We just don't want to do any less than that.
Join us outside for a demonstration on exercise and a brief discussion about exercise restriction. We want to have absolutely no off-leash activity for 12 weeks following the surgery. Please refer to your written take-home instructions for a timeline of reinduction of walking. 6 weeks following the surgery, begin introducing large circles. This will help gain muscle mass and coordination. And you're going to start with the large circles and then gradually reduce the size over the course of healing. And then you will begin doing figure 8 patterns. Good boy, Rome.
Next, we're going to talk about cold laser therapy. It is strongly recommended that you do the cold laser therapy sessions in a 3-2-1 series. So what that means is the first week following surgery, we'll do 3 sessions. The next week we'll do 2 sessions, and then the third week we'll do 1 session. We do these here in the clinic, so you will have to schedule an appointment to have that done. Cold laser therapy does a number of things that are beneficial post-surgery. It increases healing time, promotes healing, relieves pain, and provides a shorter recovery time.
Now we're going to touch base on supplements. In the hospital, we carry a supplement called GlycoFlex, which looks like this. This just has a higher level of glucosamine, MSM, and DMG. It's recommended following surgery to promote maximum joint support. Your doctor may also discuss Adequan injections with you, and you will be sent home with a couple of brochures about these supplements as well. Adequan is injections to increase joint fluid.
If at any time following surgery you have any questions or concerns, please feel free to reach out to our clinic. We are here to help. Thanks for hanging out with us today, and good luck with recovery.